Hey guys, it's me, that brown nursing student. I'm gonna be telling you what you guys will expect in your first year of being a student nurse. And this is something that many people don't tend to share out, these tips and stuff. So I've come on here and I'm hoping you guys can learn something from this video. If you do, please like and subscribe. That will be grateful. And let's talk about something which is important relatively in first year. And I'm gonna be naming it as observing. And what are we observing, and what is the limitations of what we can do and can't do in first year? That will also be talked about. And I'll be mentioning, like, let's say it's your first day, you're on a hospital ward and you get told, can you do this? But you're like, it's my first day. But the nurses don't know that. They think you're in second or third year. You can say no, you cannot. And nothing's gonna happen. At the end of the day, it's for your own protection, and you're gonna be protecting the patients. Because if you're doing something that you're not confident to do, then this can lead to complications, and this can maybe cause a fitness to practice, which you can be like kicked out for. So always ask questions and don't do something that you don't want to do, and especially if you've not seen it being done before. And in first year, observing is the most important thing. Ask, can I observe? Can I see this? And then even if they say no, it's fine. Like, many people or many healthcare professionals may not want too many people around observing the same thing. So if you're on a 6-week block, you have 6 weeks to observe in first year. If it's your first placement, you may be on 4-week block, you have 4 weeks. But depending on all that, you have to fix that mindset of yours. Knowing it's fine if I can't observe on this day, I will ask on another day. Don't give up and never stop asking questions, because the difference between an average person is they will think they know everything, whereas the person who wants to learn and is smart will ask questions and make sure that everything is normal before they do something. And you're working with your practice assessors, supervisors, get them to write your feedback sheets, or get your interviews signed off on time. You do have to chase people around to get your interview timesheet signed off as well. So please be aware that this is common in nursing in general. I think nationally as well, or globally if you're watching this from abroad. And getting someone to sign off a proficiency, or you're signing your hours that you've been here, it does drag, and you do feel like, oh my god, and I give up, I don't want to ask this person anymore. If you feel like you're not working well with your assessor, you can request to change a new assessor. And this is something that you want to be working with someone who's supportive and someone who's giving you a nice time, or making you able to learn and ask questions, and you feel comfortable working with them, and they feel approachable and stuff. If you don't feel like that's happening, I do suggest you can change your assessor. Another advice in first year I would give to someone, or I wish someone told me, is don't sit down and look pretty. And this is like, if something's going on and they all like going to that, don't just act like, in first year, this doesn't matter to me. Everything matters in first year, because you're observing. Despite you not doing anything, the least you can do is ask questions like, can I do something again? So don't be sitting there, not doing anything. Make sure like you're writing notes. Write notes. What I used to do in my first placement on the children's ward, or pediatric ward if you're American, I used to write notes from, well, this was done for the first 2 weeks. Then I just got lazy and I gave up, because it just got too hectic. And I used to write notes in my phone for like what I did and what I can do next time to do better, like mini reflections. And I still have these from my first placement. And like I used to write the days I was on shifts, and what happened in the shift, what did I do, and what could have been better. So this is something that you can take into practice as well. And if you're not doing this and you're out on placement, or you're going on to placement, please make sure you're doing this, making mini summaries at the end of the shift, looking back, because you will look back. I'm in third year now, and look back at them in first year. I'm like, I wrote I put a blood pressure cuff on a baby. I did a fluid. I got shown how to do a fluid challenge on someone. Like, and I was educating a parent or family member about this. All this comes within time, so don't feel rushed to do anything, and you will have some people who will be like, "Oh, you're so slow," or "You're so slow," but you're there to learn. And you're a student. You're supernumerary at the end of the day. You're not counting the numbers, so don't feel like you're being pressured to do anything. That's the least thing that should be on your mind, being pressured. If you do feel pressured, I mean, you can contact your practice educator if you have that on the ward, or an educator in university, and you can discuss, have one-to-ones, and make sure your well-being is always the priority, because to look after others you have to look after yourself first. So the moment you let go of yourself, that patient safety and everything, it's gonna be a bit compromised. So you're at risk of harming a patient as well, if you're not looking after yourself. So make sure your well-being is on top. I think I mentioned in the previous video to this, my first ever video, make notes and resources after you finish the shift. Research was the word I said. Research after the shift, what conditions you learn about, and always be proactive in offering parents and families or your patients a drink and snack, and make sure like everything is okay, asking any questions, can I do more, can I do anything like that. Bearing in mind, if your patient is nail by mouse, don't ever give them anything, please. Nail by mouse or NBM, which it says on the board sometimes, or there will be in documentation, or handovers. Make sure you read handovers carefully, and you can look at any nursing care plans online as well, so do that research too. And if you're working with a second or third year, ask them questions. I'm in third year. You guys can message me in my inbox or email me. I've got in my YouTube channel description and everything. So if you have any questions, you can feel free to ask. But yeah, in first year, it's all about observing, and I will be talking about how it feels to be a second year student in the next video. So please stay tuned for more. Like, share, and subscribe. Thank you.